Embarking on a fertility journey can feel like stepping into an unknown land. You might feel a mix of hope, anxiety, and perhaps a little bit of confusion. Please know that you are not alone in these feelings. Many individuals and couples walk this path, each with their own unique story and aspirations. This journey is deeply personal. It is a testament to your desire to build or grow your family. Remember to be gentle with yourself as you navigate the information and decisions ahead. Your strength and resilience are already shining through. Our aim here is to provide clarity and support. We want to help you understand the options available, such as IUI and IVF. Knowledge is a powerful tool. It can empower you to make choices that feel right for you and your specific circumstances. We are here to walk alongside you, offering information in a way that is easy to understand. The emotional side of this journey is significant. There will be ups and downs, moments of great anticipation, and perhaps some disappointments. Seek support from your partner, friends, family, or a professional counselor. Building a strong support system can make a world of difference. Intrauterine insemination, often called IUI, is a fertility treatment that many people consider. It is generally seen as a less invasive option compared to others. The core idea of IUI is quite straightforward. Specially prepared sperm are placed directly inside a woman's uterus. This is timed to coincide with ovulation, when an egg is released from the ovary. The aim is to increase the number of healthy sperm that reach the fallopian tubes. This, in turn, increases the chance of fertilization occurring naturally within the body. The process for IUI usually begins with monitoring the woman's menstrual cycle. Sometimes fertility medications are used to stimulate the ovaries. This helps to produce one or more mature eggs. Regular ultrasound scans and blood tests help track the development of these eggs. When the timing is just right, the IUI procedure is scheduled. It is a relatively simple procedure. Many find it to be a manageable and gentle first step in assisted reproduction. The IUI procedure itself is quite quick, usually taking only a few minutes. It is performed in a clinic setting and does not require anesthesia. The woman lies down, much like for a gynecological exam. A speculum is gently inserted into the vagina to allow the doctor to see the cervix. Then, a very thin, flexible catheter containing the prepared sperm sample is passed through the cervix. The sperm are then gently deposited into the uterus. Most women report minimal discomfort, perhaps some mild cramping similar to period pains. After the procedure, you might be asked to lie down for a short period, perhaps 15 to 30 minutes. Then you can usually resume your normal daily activities. There is no special recovery time needed. The 2-week wait that follows, leading up to a pregnancy test, can often be the most challenging part emotionally. It is a time filled with hope and anxiety. During this period, it is crucial to focus on self-care. Engage in activities that you enjoy and find relaxing. Lean on your support network. In vitro fertilization, or IVF, is a more complex and often more effective fertility treatment. The term in vitro literally means in glass, referring to the fertilization of eggs with sperm outside the body, in a laboratory dish. IVF involves several carefully coordinated steps. It begins with stimulating the ovaries to produce multiple eggs. This is followed by retrieving these eggs from the ovaries. Then the eggs are fertilized with sperm in the lab. If fertilization is successful, one or more embryos are then transferred into the woman's uterus. IVF is often recommended when other treatments like IUI have not been successful. It can also be the first-line treatment for certain conditions. These include severe male factor infertility, blocked fallopian tubes, or significant endometriosis. Older women or those with a diminished ovarian reserve might also be advised to consider IVF sooner. The comprehensive nature of IVF allows doctors to overcome many common barriers to conception. It offers a higher chance of pregnancy per cycle for many individuals and couples facing fertility challenges. Navigating IVF, the procedure, advantages, and investment. An IVF cycle typically starts with ovarian stimulation. This involves self-administered hormone injections for about 8 to 14 days. These medications encourage the ovaries to produce multiple mature eggs, rather than the single egg usually released in a natural cycle. During this time, you will have regular visits to the fertility clinic. These visits include blood tests to measure hormone levels and ultrasound scans to monitor the growth of the follicles containing the eggs. This careful monitoring helps to ensure the eggs are retrieved at the optimal time and reduces risks. Once the eggs are mature, the egg retrieval procedure is scheduled. This is a day-case procedure performed under sedation or a light general anesthetic. A thin needle, guided by ultrasound, is passed through the vaginal wall into the ovaries to collect the eggs from the follicles. The procedure usually takes about 20 to 30 minutes. On the same day, a sperm sample is collected from the male partner or a donor. In the laboratory, the embryologist will then combine the eggs and sperm, or perform ICSI if planned, to facilitate fertilization. Over the next few days, the fertilized eggs, now embryos, are carefully monitored as they grow and divide in the laboratory. Section 6, IUI versus IVF. A closer look at success and suitability. When comparing IUI and IVF, success rates are a primary consideration for many. Generally, IVF offers a higher chance of pregnancy per cycle compared to IUI. IVF success rates can vary widely, often ranging from 20% to over 40% per cycle, depending heavily on the woman's age and the specific cause of infertility. For women under 35, success rates are typically higher. In contrast, IUI success rates are usually lower, often in the range of 10% to 20% per cycle. However, IUI is less invasive and less expensive. The suitability of IUI versus IVF depends greatly on individual circumstances. IUI may be a good starting point for younger couples with unexplained infertility, mild male factor infertility, or issues with ovulation that can be managed with medication. It is also a common choice for single women or same-sex couples using donor sperm. IVF, on the other hand, is often more appropriate for women with blocked or damaged fallopian tubes, severe endometriosis, significant male factor infertility, or those who have had several unsuccessful IUI cycles. Age is also a critical factor. Older women may be advised to proceed to IVF more quickly. Factors affecting success rates for both procedures are numerous. Section 7. Making your choice guidance for your unique journey. Choosing between IUI and IVF is a significant decision. It is one that should be made with careful consideration and ample information. Think about your personal circumstances. This includes your age, your diagnosis, and how long you have been trying to conceive. Your emotional readiness for each procedure is also very important. IVF, for instance, is generally more demanding emotionally and physically than IUI. Consider what feels manageable for you at this point in your journey. There is no right or wrong answer, only what is right for you. Financial considerations often play a substantial role in this decision. IUI is typically less expensive per cycle. However, if multiple IUI cycles are needed, the costs can add up. IVF has a higher upfront cost, but may offer a higher chance of success per attempt. This could potentially lead to a quicker pregnancy and, in some cases, be more cost-effective in the long run. Explore all funding options available to you. Speak openly with your clinic about costs and payment plans. This financial clarity can reduce stress. Section 8. Stories of Hope. Real Journeys, Real Miracles. Sarah and Mark had been trying for a baby for 3 years. They felt a mix of hope and apprehension when they started their fertility journey. After consultations, they decided to try IUI. Their first cycle was filled with nervous anticipation. Sadly, it was unsuccessful. They felt disheartened, but decided to try again. The second IUI cycle also did not result in a pregnancy. Their doctor then discussed moving to IVF. Though it felt like a bigger step, they agreed. Their first IVF cycle was challenging, but it brought them their beautiful daughter, Emily. They often reflect on how each step, even the disappointments, led them to her. Another story is that of Aisha, a single woman in her late 30s. She always knew she wanted to be a mother. She decided to use donor sperm and started with IUI. She understood that her age might mean it could take a few tries. Her first 2 IUI cycles were unsuccessful. Aisha remained positive and focused on her well-being. On her third IUI attempt, she received the news she had been dreaming of. She was pregnant. 9 months later, she welcomed her son Noah. Aisha's story shows that persistence with IUI can indeed lead to joy, even when the path isn't immediate. Consider journey is undeniably one of the most profound you may undertake. It tests your resilience, your patience, and your hope. Yet it also reveals your incredible strength and your deep capacity for love. Remember that seeking help and exploring fertility treatments is a proactive and courageous step. It is a testament to your commitment to building your family. You are already doing so much. Making informed decisions is key to navigating this path with confidence. Continue to ask questions. Seek clarity from your healthcare providers. Lean on your support network, your partner, family, friends, and support groups. You do not have to carry the weight of this journey alone. There is a community of people who understand and who want to support you. Your emotional well-being is just as crucial as any medical aspect of your treatment.